Hello and welcome to today's episode of the Scottsdale Living podcast. Today's guest is Dr. Ross Stutman of Stutman Plastic Surgery. Hello.
Hi, Amber. How are you?
I'm great. Thanks. How are you?
I'm doing great.
So I know you've been an Arizona resident since 2012 and you're a graduate of U of A.
That's right.
Bear down.
That's
no,
right.
I'm not actually. I'm a lumberjack, but we can fight about that later.
You're like neutral. It's not ASU, so it's okay.
Oh, yes, exactly. We're just like hanging out in the trees up there.
You're like
not bothering anybody.
You know, I always think you guys as being pretty neutral. Yeah.
So I know that you are a plastic surgeon, and a lot of people, we live in Scottsdale. A lot of people want to know a lot of questions about plastic surgery. So not to grill you, but what is that actually like? Do you love it? Is it like overwhelming? What is this job in Scottsdale?
It's been great. I really love practicing in Scottsdale and Arizona in general. I've been here for about 12 years practicing since I finished all my training. And, you know, Scottsdale is just a great place to live, to work, and just to be. There's so much to do here. The people are just awesome. I really find that, you know, Arizona people, although they might come from all over the country, really, once they move here, they really are kind of a happier bunch than a lot of other places I've lived.
I love that. I totally agree. It's something about the sunsets and the heat that just makes people not angry.
That's right. That's right.
Willing to help you, willing to say hi, smile. Like that's actually a thing here. So I love it. So where'd you come from before Arizona?
So I grew up in Los Angeles. And after high school, I went to the University of Arizona, like we just said. And that's when I really fell in love with Arizona. So Arizona was kind of like a family school. Both my parents had been there. My brother was going there. And it was sort of like, you're going to U of A or, you know, good luck to you, right? And I was a little bit hesitant to go to Arizona. But after I was here, I really, really loved it. I loved my time in Tucson. And when I was in Tucson, you know, I had an experience of being able to come to Phoenix, to go shopping, to go to restaurants, go to sporting events, because that's a big part of my life is going to like professional sporting events and those types of things. And I just fell in love with the whole Phoenix area. And I kind of always had it in the back of my mind that once I finished all of my training, that I'd probably come back and live here. And that's what happened.
Yeah, same. I'm from Arizona. I actually grew up an hour south of Tucson. So Sierra Vista.
Sure.
So we'd go up to Tucson all the time, moved away, traveled all over the country, and then always knew I would come back to Arizona. And anytime I've left to go work anywhere, I'm like, it'll be a year max. Like, that's it.
Right.
It's amazing here. So you came from LA and then came to Scottsdale. So, like in the world of plastic surgery, I feel like plastic surgery is incredibly prominent. Whereas when I was younger and, you know, in the early 2000s, I felt like it wasn't. Like people, maybe it was less accessible cost-wise. Is that a thing? Is it more accessible now for the same kind of work or less cost-wise?
You know, I think it's probably about the same with regards to inflation and whatnot. I don't think that the prices have really changed all that much. But what I think has changed is just the perception of what plastic surgery is. And yeah, growing up in LA, obviously, plastic surgery was probably more popular in Los Angeles than it was in Sierra Vista, you know, in the 80s and 90s when I was growing up. But I think over the last 20 years, like you said, it's definitely become just more accessible for a lot of reasons. I think, you know, social media has had a big impact on that. People are now actually seeing, you know, as opposed to just opening up a Yellow Pages and seeing, okay, plastic surgery. Now they're actually seeing Instagram profiles of what we can and what we can do for you and how we can build self-confidence. And I think that it's just gained popularity for a lot of different reasons. Obviously, celebrities and just people are more open about talking about it. You know, back in, you know, I would even say 15, 20 years ago when I first started training, I think there was a kind of a privacy aspect to it. And now you look around and everyone's showing off their breasts and they're showing off their facelift incisions and they're talking to their friends about Botox and, you know, all these things. And I think, you know, actually Botox is a great thing to talk about because really it's such a minimally invasive thing. It didn't really start coming out until the mid 2000s. And then people started saying, well, it's so easy to do. It does such a great effect on my face. It's, you know, making me feel better. And I think it was sort of a gateway into people talking about it. People weren't afraid to talk about it anymore. So I think it's just perception has changed quite a bit.
I would definitely agree with that. Actually, I had a patient who had frozen shoulder and her husband did Botox in his medical office. And I got her in and out really, really quickly. And he was like, come in, you're getting free Botox. And I had like the angriest line on my face. Like my mom would walk up and be like, stop doing that with your face. I'm like, it's just my I'm just reading.
Right.
I'm
Right.
smiling right now, but
Right.
it looks so angry that everyone thought I was angry. And if I let it soften, it does. And it impacts the way that everyone interacts with me. And I thought, oh my gosh, what a small thing to alter to help me communicate with people.
For sure. And
I mean, such a strange thing.
It is, but they've done actual studies and shown that people that have Botox in their face, their depression levels can go down and just crazy things that because our self-perception means so much to us. You know, our body, when you look in yourself in the mirror and all of a sudden something looks better, you start feeling better about yourself. Your confidence goes up, you know, depressive symptoms go down. And it actually does make a lot of people really sort of happier.
Wow. Okay. So, I mean, that's kind of blowing my mind because you think about the number of times people look at themselves in the day. And especially people who are massively on their phones.
Oh yeah. And
my gosh.
Well, I mean, we can talk about, we called it the Zoom boom, right? During COVID.
Oh my gosh.
COVID, so 2020 and 2021 was a massive boom for the plastic surgery industry. And one of the reasons, there were multiple reasons we could talk about, but really one of the reasons was Zoom. So people used to sit in their office and they'd sit in a conference room and they're not looking at themselves the whole time. They're looking at other people. But now you've got this computer screen in front of you. You're looking at your own face. Wow. And all of a sudden you're seeing, oh my gosh, those lines around my eyes are getting worse. I was doing so much like chin implants and liposuction underneath the chin because people would be looking down and all of a sudden seeing those double chins that, maybe they noticed it in pictures, but now they're noticing it every single day. And when they're talking to their colleagues on these Zoom meetings. And then again, in COVID, the other thing that really caused a boom in our industry was people weren't having to go into the office anymore. Mm-hmm. And so I saw so many patients that were, they'd been wanting to do something like, say, a breast augmentation or a tummy tuck. And they've been wanting to do it for years, but they just couldn't find the way to tell their employer or tell their work, I have to take 2 weeks off of work. I want to take a week off of work. Now they're working from home, so they can go get their procedure done maybe on a Friday. And most people are back in front of their computer on Monday. And their employer knows nothing about it. They don't have to have those awkward conversations. They don't have to go into the office, all of a sudden looking different and awkward with their colleagues. So that was another reason that we had such a boom in the industry during 2020 and 2021.
I was just thinking of like a Zoom camera scheme or something where they could like take a video of themselves and then play the video back in front of the camera. So it looks like they're paying attention to the whole meeting. Like
exactly.
No FaceTime, but their camera's actually like not on them.
Right.
Oh my gosh. Okay. So that is amazing. Yeah. I never really thought about, I didn't really use Zoom. I have an in-person job. But that makes so much sense. Everybody who's on one of those that can see themselves, they're looking at themselves.
That's right.
Like the whole time. Wow. Okay, so I love too the decreased depression risk thing about the Botox. I can't get over that.
Yeah.
Okay, so brilliant. Tell me a little bit more about what makes you stand out. I know that, you're like, well, I went to college in 2012. Tell me the good stuff.
So I went to college. I actually graduated U of A in 2000.
Okay.
And then from there, I actually went to medical school in Chicago. I went to Loyola University Chicago, which was an awesome experience. I'd never lived in the Midwest.
Great time to be there.
It was great. It was freezing, but it was great, right? Very different from a kid that grew up in LA and then was living in Tucson. Mm-hmm. From there, I did my residency in plastic surgery. I was able to get a plastic surgery residency right out of medical school, which back in 2005, when I graduated medical school, was pretty rare. There was about 45 students a year that was able to go directly from medical school into a plastic surgery residency. What most people did back then was you would do a full general surgery residency and then apply for a fellowship in plastic surgery. So I did a 6-year program in Las Vegas. And then after I finished my residency, I knew that I wanted to just extend my education a little bit more. And something I really fell in love with during my residency was what we call oculoplastic surgery. So surgery of the eyelids and eyelid structures. And I just felt that was the most unique and exciting anatomy for me. It was really tiny and really intricate. And it just I just loved it. And so I did a fellowship in oculoplastic and cosmetic surgery. I'm actually the only fully board certified plastic surgeon in the state of Arizona that's also done an oculoplastic fellowship. Now, that doesn't mean that there's not great oculoplastic surgeons in town here as well, but they go through a little bit of a different process. They do an ophthalmology residency first, and then they typically will do a 2-year fellowship in oculoplastic surgery.
Okay, so ophthalmologic, say it again.
Oculoplastic.
Oculoplastic, but the other one that isn't...
Ophthalmology.
Okay, so ophthalmology surgery, how does that differ from the oculoplastic surgery?
Right. So ophthalmologists are treating diseases and disorders of the eye itself. So cataracts, glaucoma, retinal detachments, those types of things.
And what about like lazy eye?
Some
is
lazy
that
eye,
more muscular, like attachment?
Yep. Strabismus surgery, and that is oculoplastic surgery.
That is oculoplastic.
Yep. Some general ophthalmologists will do that as well. But so that's sort of how the ophthalmologists go. And then they usually will then subspecialize. They'll do general ophthalmology, or they will subspecialize in, say, retinal surgery or oculoplastic surgery, or, there's a number of different subspecialties within ophthalmology. What makes me different is that I wasn't doing 6 years of treating glaucoma and cataracts. I was doing 6 years of treating chronic wounds, burns, cosmetic surgery, hand surgery, really focused on surgical procedures as opposed to, medical disorders of the eye. But I just found the anatomy really interesting. And plastic surgeons, we do tons of cosmetic surgery around the eye, but I just felt like I wanted to just extend my education a little bit more. And I had a great experience doing that. And so now I'm kind of one of the plastic surgeons in town where I'll have a lot of colleagues that will do blepharoplasty surgery, which is, eyelid surgery, which is super common. And most plastic surgeons in town will do a great job with it. But there are some complications of that surgery.
Right.
And it's like you can get like a droopy eyelid. Right.
Oh, no.
That's kind of the most common thing. Sometimes your eyelids won't close all the way after
so
surgery.
Is that from like is it from you accidentally cutting a nerve?
It's typically not a nerve. It's typically resection of too much skin or disrupting some of the deeper levels of the lower. And that's like typically the lower
like it has
eyelid.
Too much tension, so it's pulling across instead of allowing it to move up.
Well, you're talking about the upper eyelid. I'm thinking more about the lower eyelid.
Okay.
So you get almost like a hound dog look where your eyelid actually starts to pull down. And that can be from scar contracture. It can be from disrupting some of the anatomy. And there's a little ligament in the side of the eye that kind of holds everything up. It's almost like a sling. And so if that little ligament gets disrupted, or sometimes you actually want to tighten it during blepharoplasty surgery to protect it. There's a lot of different reasons why these things can happen. And sometimes, like I said, surgeons can do a good job, but it's surgery and everybody heals a little bit differently. And so if you do get some of those complications, a lot of the plastic surgeons in town will then refer those patients over to me to care for those issues.
I know nothing about plastic surgery, but I do know that in other surgeries, after the surgery, they'll do like a PRP lavage or something that helps with the stimulation of healing. And most people kind of know what PRP is that are kind of interested in health or joint health or are aging and considering what their options are that aren't surgical. So is that something that you do for all plastic surgeries, or like what's the protocol?
So platelet-rich plasma is what you're talking about, PRP. And what it does is it takes your body's own platelets and the stem cells within those platelets to try to reduce inflammation, increase collagen, elastin, all those types of things. It's not something that's done, typically with some of the facial plastic surgeries that I do. It can be definitely an adjunct to those types of things. I always tell my patients, and I do a lot of facelifts, that, it's almost like, repairing a car, right? You've got your body work done. And in plastic surgery, in the operating room, I can definitely fix the body work. If you've got something pulled in, you can definitely pull it back out and fix it and pull structures back where they need to be. But the skin is like the paint job. It's a totally different process. And so what we want to do is there are different things like lasers or chemical peels or PRP, radio frequency devices that can actually help your skin texture and quality. That's something I can't fix in the operating room.
Okay, so these are like post-procedure touch-up paint.
It's not even necessarily post-procedure touch-up. It's during the procedure or after the procedure. It's doing the paint after the body work's been done.
Okay. Wow, I didn't even think about that part. I mean, I've seen some serious scars from people who've had terrible accidents, like you were talking about burns. This is a crazy one. People who fall, who cannot get up from the ground in Arizona, almost always get burns in the summer.
Oh, yeah.
It's like you land on your hip or you land face down. And so I've seen some terrible ones that, I don't know if it was a plastic surgeon that did it. So they have like a fairly massive scar
Yeah.
that remains. How do you know if you need to request a plastic surgeon when you have an accident?
That's a really great question.
And is that allowed?
It is. So typically, let's say you have an injury, the first place you're going to go is usually your urgent care or the emergency department. If it's a laceration or a cut, it depends on how deep that cut is and what area of the body that cut is and how much tissue is missing.
Mm-hmm.
If it's a straight line cut, it's pretty superficial. Rest assured, our emergency room physicians are excellent at treating those types of things.
Mm-hmm.
They're going to know when to call in the plastic surgeon. So, the most common times that I was called in for, and I don't take ER call anymore, but I did for many, many years. The most common things that we get called about are lacerations, obviously to the head and neck area. If it involves like the eyebrow or the eyelid or the lips, ears, things like that, they're typically going to call us in. And obviously in the face, there's a lot of deeper structures that are very important. So nerves, blood vessels, and the like. And so if any of those structures are exposed or the emergency room physician is concerned about structures being disrupted, they'll call in the emergency room or they're calling the plastic surgeon.
Okay.
A lot of times what'll usually happen is that the emergency room will repair your laceration. They'll look at your burn. They'll give you some creams and they'll say, follow up with your plastic surgeon for maybe some scar touch-up in the future. And so I see a lot of those types of patients that come to me that have had an accident that the emergency room physician says, okay, let's sew it up and let's see how it does. And let's send you over to the plastic surgeon for follow-up care. And scars take a long time to heal. So we really don't know what they're going to look like. So I'll usually have a long discussion with the patients about what we can do, sort of minimally invasive, help that scar heal. So things like sun protection is really important. It's probably the most important thing when it comes to scarring. And I'm really a big proponent of silicone scar gels or tapes. I think that those have really been shown scientifically, clinically to make a difference in how your scar will heal. But really, in the long term, a lot of it is just a picture of time, right?
Yeah.
You just want your body to heal things up. And then if you've got divots or indentations, then sometimes you need a little revision. That can be, cutting that scar back out and closing it up a little bit nicer. Sometimes doing fat grafting underneath the scar to, kind of puff things back out. Exactly. Or doing fillers. And there's a lot of different options. And then, of course, things like lasers work really well to take out like redness and pigmentation changes.
Wow. Okay. I really hadn't even thought of, like if someone had MRSA or some terrible infection or what about post-grafts? Is that something that you can still treat?
Post-skin grafts?
After it's healed?
Yeah. Skin grafts, it depends on what type of skin graft you use. A lot of people if they have like a big burn injury, you'll see burn patients and they'll have almost like that meshed look to the skin. And the reason that we do that, and it never really looks amazing, right? The reason that we do that meshing process is because we're trying to expand the amount of skin that we have to take or harvest from them.
Right.
And so we can expand it by putting those meshes in. The problem is once those meshes are in, it kind of always has that meshed appearance to it. So there are things that can be done in the future. So one of the things that's really cool process, patients don't love it, but it's a really cool process. It's called tissue expansion. I don't know if you've ever heard of that.
No.
So what we'll actually do is put in little balloons underneath their skin in the area surrounding that grafted tissue. And through this process where we can expand the normal skin around it, we can start to cut out that skin grafted area and replace it with their normal skin in that area and just kind of move it over.
Got it. That makes sense. I mean, like that makes perfect sense because technically like breast tissue, same thing.
Same
right?
thing.
And so that makes me think of a friend of mine growing up. She had like terrible breast cancer, had bilateral mastectomies. These were the worst scars I have ever seen on a woman's body. And I've seen a lot of different kinds of injuries. So it was breathtaking. And she had gone to surgeon after surgeon after surgeon after surgeon. And unfortunately, I guess the incisions, I don't know if they weren't healing well, but she had had several infections and they kept trying to stretch tissue around that it would not stretch anymore. Or I don't know, they needed to give it way more time, or maybe it was too aggressive. I have no idea. But like that process has to take some time because basically you're just asking the skin to give.
That's right. It does take time and there are complications with it. Like your friend may have just had really thin skin, really thin breast tissue from what was left after her mastectomy. If they have radiation, tissue expanders just don't work. So radiation and tissue
Right,
expanders.
because that's like a burn
It
through
is,
your
and
skin.
it
It's
basically,
plastic.
yeah, radiation, it really is not the plastic surgeon's best friend. So in a case like your friend, she has options. And really the first thing that comes to mind is free tissue transfer. So we can actually take skin and fat from your belly or from your back.
Under my armpit.
Under your armpit, move it around to the chest or wherever the injury is. So we call that free tissue transfer. And that's bringing in healthy tissue into that area, which can actually, help things heal up and actually can have a very nice cosmetic result. Sometimes much nicer than just, a big mastectomy scar with, a tissue expander inside of it and eventually an implant. So, we call that autologous tissue transplants. And we do it all the time for not only for breast cancer, for other types of cancers, but really common for trauma injuries and things like that, where, the patient has just lost a lot of their own tissue and we need to kind of resupply that area with an area that can maybe lose that area. So for example, people love, we call it DIEP flaps or deep flaps for breast reconstruction because the woman gets basically a tummy tuck out of it. We're taking the tummy skin that we would do. It's almost the exact same incision that you would use for an abdominoplasty or a tummy tuck. And you can use that skin very low. We try and keep it very low. And you can take that skin and move it right up to the chest. And you can use it for your breast tissue. And now you get a tummy tuck out of it. So
fascinating.
So there's lots of different options for breast reconstruction these days.
Okay. Interesting question. Pregnancy can tear your abdominal wall. And sometimes when they do a tummy tuck, why don't doctors just go in and suture that immediately, especially if a woman has like a C-section?
Okay. So that's a great question. And at the time of the C-section is not the time to be doing cosmetic surgery. You're very full. Your tissues are very boggy.
Okay.
Your hormones are doing all sorts of things to your body. If you've ever been pregnant, you'll know that, changes in the skin quality, changes in your breast. So right during pregnancy, not the time to do it, right? Too many complications, all those types of things. So down the road, I usually recommend that my patients are about a year out from pregnancy before they start really thinking about cosmetic surgery because, you don't want to be breastfeeding, first of all. Typically, I tell people stop breastfeeding for about 6 months before your surgery because hormones are going to change and your body shape is going to change as well. Even if you're not thinking about doing breast surgery, it just does affect your hormones and how you're going to heal. So typically after about a year, that's when we start thinking about doing like mommy makeovers and tummy tucks. And what you're describing where the muscles kind of tear, it's actually not a tear of the muscles. We call that rectus diastasis. Nothing's actually tearing. What's happening is that between our abdominal muscles or like the six-pack muscles, there's a little ligament that runs between those areas. And it's not muscle, it's just a little piece of stretchy tissue. And I always tell my patients, it's like a pair of elastic socks. It's not a rubber band. So with every pregnancy, just like pulling your elastic sock, it just isn't going to go back the way it was before. And so, especially with multiple pregnancies, or if you had a lot of weight gain during your pregnancy, that little ligament gets really loose. And those muscles actually start to separate from each other. And so what we do, while there's not a hole there, the ligament is still there. What we do in tummy tuck surgeries, we'll actually go in there, we'll find the two edges of your muscle and we'll sew them together. So you get a nice tight abdominal contour. I call that like an internal corset. That's the best way to think about it.
It's just fascia around fascia, right? You just pull them together.
We're what's called plicating the fascia of the rectus muscle. And we're pulling it together so that looseness kind of gets imbricated or put inside your belly a little bit. It kind of just tightens up the whole abdominal wall.
Internal corset. Brilliant.
Yes.
Okay, I love that. So everybody likes talking about the things that are awesome about plastic surgery. What are the things that people need to look out for as far as like they're considering going in? They want to pick a doctor. Like I have a friend who, she had a rupture of one of her silicone bags. She's had them for like 20 years. What were they previously?
Well, it could have been saline or it could have been silicone. So back in...
It immediately deflated.
Okay, so that was saline.
Okay.
So silicone is like a gel. It's a gel-filled device. And that gel can ooze out with a rupture of it with the old generation implants. The new generation implants, we call them gummy bear. You may have heard that term. And the reason we call them that is because if you were to cut into one of these implants, nothing oozes out. It's like if you bite into a gummy bear, nothing's oozing out. You just kind of see it there. So the same thing happens with our current generation implants. Back in early 1990s, they actually put a moratorium on silicone implants because they thought they were causing problems.
Mm-hmm.
And so for many years, we were only allowed to use saline implants, which is a silicone shell with salt water inside of them.
Mm-hmm.
And so when those devices fail, it's just salt water. So your body will absorb it. So if you have a rupture, it's like getting a hole in the balloon, right? And the water's just going to leak out and your body's going to absorb it. And you'll know within about 48 to 72 hours that it's gone because you'll go back to where you were before. Yeah.
Yeah. So she waited a really long time because she was like, well, I don't really have the money to do a plastic surgery right now. But so she went to Mexico and got a surgery. And, she ended up, I think, with like kind of an infection on one side. So they ended up not being symmetrical because during her healing process, she was, swollen on that side.
Yeah.
And, she was very like confident, like it's the same. So when people are thinking about plastic surgery and they're thinking about cost of plastic surgery, where they are like, yeah, you could probably take the risk with this, but you don't want to take the risk with this. And how do we know?
Right. That's a great question. And I'll start out by saying that complications are going to happen, right? The only surgeons that don't get complications are the surgeons that don't operate. That's a saying we say in surgery. And so what you want to do as a consumer looking for plastic surgery is you want to try to mitigate those risks as much as possible. So the first thing you want to do is you want to look for someone that's certified by the American Board of Plastic Surgery. And there are a lot of boards that sound very similar to that, but they are not true boards. A lot of these boards are sort of faux boards. They're not recognized by our sort of overall sort of governing body of medical specialties. Okay. So American Board of Plastic Surgery is where you definitely want to start. You'd also want to find a surgeon who is a member of the American Society of Plastic Surgeons. You can only become a member if you're board certified. And there are many stipulations of being a member that require you, for example, to operate in only accredited facilities. Okay. So if you find someone with those two qualifications, you're going to be in the best possible hands. Okay. In other countries, if you wanted to try and, save some money and go down to, for example, Mexico, which is really common, you might actually find a surgeon that is certified by the American Board of Plastic Surgery and an ASPS member. They do allow for international members. The problem is that most of those doctors are not. And while there are excellent, phenomenal surgeons in different countries, sometimes you just don't know what you're going to get and it's not quite as regulated. So you don't, so their governing bodies might not be quite as strict in regards to sanitation, cleanliness, and those types of things. The other thing I always caution my patients about is, let's say you went to a great plastic surgeon, all your friends went there, they're down in Mexico, they had a great experience, but let's say you're one of those rare patients that gets a complication. So what are you going to do?
Right? You're going to go all the way back down there to see your doc?
Back there. And a lot of those, I've seen so many patients when I used to take ER call that would say they had terrible raging infections. I called my doctor down in Mexico or in Belize or whatever country they had it done in. And they said, well, go to the emergency department because what can I do for you there? And a lot of them have even gone back to Mexico and the doctors are sort of closed up shop and moved somewhere else. There are a lot of scams. So, you really don't know what you're getting when you go outside of the United States. And if you're not going with someone that has those two certifications we just talked about. So I would just caution people. And that doesn't, I'm not bad-mouthing our colleagues to the South. No. There are some amazing surgeons. There are some great surgeons in South America. I mean, in fact, Brazil had one of the grandfathers of modern day cosmetic plastic surgery. So, there are people other places, but if I generally tell people you want to have plastic surgery pretty much local, because if there is a problem, you want to be able to deal with it.
Okay. So actually the only breast augmentation patient that I have ever seen, I had to see, she had an approach that was through her armpit, basically, like right on the front of her armpit. And unfortunately, she had like some paralysis going down to her hand. So she couldn't type, she couldn't use her pinky. She really couldn't grip for a while. So she needed therapy. How common is something like that? And if that's common, is that like not a great approach for maybe someone not with a lot of tissue or who is thin? Is that not really used anymore?
No, it actually is. There's three main approaches that we use for breast augmentation surgery. The most common, the one that I typically do, is in the breast fold. And there's a lot of reasons for that, and I can get into it.
Like but underneath
the breast fold, exactly. So it's really well hidden because it's in the crease of the breast. The armpit approach is a great approach. Most of the time it's done with an endoscope. So you actually use a camera when you're inserting it through there. My guess is that your friend probably had some sort of stretching injury of one of those nerves that was causing that issue. Because as we're kind of tugging and pulling to get that implant in, there's possibility for that to happen.
And there's a lot of nerves that pass through that
there's
area.
A ton of nerves,
and they all serve the arm.
And a very important nerve is the brachial plexus, we call it. It's very important for, hand motion and arm motion. That is a rare complication, at least a long-term complication. You can get sort of...
I'd only had one in my whole career, so it must be.
It is extremely... That is not a typical problem with that approach. The bigger problems with that approach that I have found is, number one, like I said, you have to use an endoscope. So it increases the time of the operation.
And you're talking about basically on this microphone cable, it's just a camera that's on the end of like one of these.
Right. So
and it's
usually
like wired in so you can see what you're doing.
Exactly. So there's a little like retractor typically. And on the end of the retractor has a little camera. And so you have to do all your dissection through that camera. Okay. So it takes a little bit longer and there's more skill involved and there's more equipment involved. And
because now you're video game surgery.
Exactly. There's a lot of that video game surgery stuff, which can be a lot of fun. But the problems that I found with that approach is that I personally have a tough time getting the pocket exactly where I want it going through that approach. Okay. The other problems I find with the armpit approach is that if you do get a pore scar, it's and you want to go to the beach and you're wearing a bikini, you're going to see it, right? Whereas with the other two approaches, you're wearing a bikini, no one can see it.
Nobody can see it.
The other approach that was common for many years was to go underneath the areola, that kind of darkened part around your nipple. The problem with that is that we have to actually cut through a lot of breast tissue to get to the pocket that we're going to form. And the more breast tissue cut through has been shown to increase the amount of bacteria that leaks out. And that bacteria that's leaking out, while it typically doesn't cause a true infection, it can increase the risk of something called capsular contracture, where you get some like hardening around the implant. And the other reason why...
Like a scar pocket.
Exactly. And the other reason why I like to do what we call the inframammary fold approach is that if you have a complication, almost all your doctors are going to go through that approach now. So let's say you went through your armpit and now you've got a complication.
Yep. They went right back
you want to take the implants. Now you've got two scars on your body. You've got one in your armpit and one in your fold. So for all those reasons, I typically like to do the fold. And then the other thing about the fold incision is, a lot of my patients, the most common reason that they'll come to me for a revision down the road is that, the implant doesn't have any problems, but your breast tissue continues to age.
Right.
Maybe with pregnancy, just age.
Gravity
pulls things down. And so now they want to lift. And so where is that lift incision going to be? Now you've got a lift incision where you would have had your old incision, and now you've got a lift incision and an armpit incision. So for all those reasons, I just don't typically use that approach unless someone is really, really wanting it.
Okay, well, brilliant. Thank you so much. This has been... I think people are going to love this one. Okay. Wow. Okay, so I love it. You are very well qualified. You're fantastic to talk to. I think one of the things some people might not want to do is like the process of going into the office, right? Like, oh my gosh, I want this done. And then you have to stand in front of your doctor.
Yes.
What do you guys do to make that like less awkward?
That's a great question. And that's actually, I have designed and built my practice from the ground up, from everything from what the floors look like to the staff members. And the staff members are so important. My staff is amazing. And it's like a family. When you come into my office, you're going to be greeted with a smile from my front desk associate. My patient care coordinator is just awesome. She is like the sweetest person you'll ever meet. And they're going to calm you down before you even see me. Okay. So by the time you get to me, you're going to be chill, you're going to be relaxed, you're going to be educated, and you're going to be ready. Okay. And I always tell people that, you kind of got to get rid of the modesty when you walk through the plastic surgeon's door, right? And we're going to make sure that you're comfortable doing that. So it is awkward. We understand it. You're standing in front of strangers, showing them, these areas of your body that you are, you're concerned about, you're self-conscious about. And so it can be very difficult. So we do everything we can to make it as comfortable as possible for our patients. And I promise you that everyone leaves, they're like family. I mean, we have people that send us like their Christmas cards from like, 10 years ago. They really do feel like family. And I like that environment.
Yeah.
That's kind of what I've been building up for, is just making you kind of really feel comfortable, really feel like you're a member of the family, because, you are going to be seeing a lot of us during your recovery. And for example, with breast implant surgery, I will see you every single year for the rest of your life, as long as you've got those implants in. So I want to make sure that everything is healing up the way that it's supposed to, that everything's feeling good, that you are I'll make sure that you're going to get your mammograms when you're of appropriate age. And, I will do your breast exams to make sure nothing is going on, wrong, and those types of things. So, you're going to be a part of the family for a while. Yeah.
Last question I have for you, and then I'll let you go.
Okay.
Tell me something about someone that really rang for you, where you were like, this is why I do what I do.
Okay. So that's a great question. I've had so many amazing patients. I will tell you that, the story that a lot of people ask me is like, why did you get into this? How did you get into plastic surgery?
Yeah. Is it LA or?
Yeah, no, it wasn't. So I went to medical school and I thought, I was always creative. I liked art. I thought, it was on my radar, but I didn't know for sure. And when I went to medical school, the first year of med school, I was like, I'm pretty sure I want to do surgery. And so I just shadowed a bunch of surgeons, orthopedic surgeons, spine surgeons, cardiac surgeons, all these things. And then I went into the plastic surgery room. And I remember my very first case that I was literally just a first year medical student. And I am just in the operating room, just watching. I'm not scrubbed in. I'm literally just observing. And they were doing a breast reduction. Okay. And I'd met the patient in the pre-op area. And she was like, the reason I'm doing this is, I've got neck and back issues and all these things. I was like, well, this is great. Okay, well, good. So we're actually going to, not only are we going to make you look better, but you're going to feel better physically. Right. Mm-hmm. And I'm in the room and I'm watching the surgeon and the residents, and they are literally, if you've never seen a breast reduction, I recommend against it. Don't watch it if you want to get it done, because it looks completely brutal. I'm watching this case and they are making cuts left and right, and the breast is splayed completely open. I'm thinking, you are mutilating this. I just talked to this woman. She's so sweet. Why are you doing this to this poor lady? 2.5 hours later, the breast comes back together again. It's perky. It's youthful. It's smaller than before. It looks amazing. Boom. I want to do that. Teach me how to do that. That is so cool. And so, rounded on this patient, saw her afterwards.
That's not how I thought this story was going to go.
saw her afterwards, and she, I saw her for 3-month visits, and she's in the office. She's, I feel great. Everything is amazing. Looking at everything looks great. And I was like, when I saw that surgery, I was like, I want to learn how to do that, because what just happened was crazy. And so that's...
And you'd already done surgeries, orthopedic surgeries.
But I was, exactly. I'm watching people hammered, and it's just, I thought that was kind of boring, but here they're like, it's creative. And it's like,
such an important area. This woman came in because this is important to her for so many reasons. And so the responsibility level of that is through the roof.
It is. And
touching someone's face.
I was mortified when I was watching this surgery.
Wow.
And I was just like, what are you guys doing? And then at the end of 2.5 hours, it all came together. And I was like, I was just so in awe. And so that's why I did it. I always like being creative. I like putting together like puzzle pieces. I like, just everybody's different. That's the thing about plastic surgery, is that not only do we treat every age. I've literally been in the operating room doing a cleft palate on a 3-month-old, and then doing a skin cancer reconstruction on a 90-year-old. And in the end of the day, maybe a breast augmentation on a 22-year-old. So we see every age group, all different. We operate on skin, we operate on bone, we operate on muscle. Every part of the body. I just never thought I'd get bored. And so that's why I went into it. And I haven't been. And so my practice has evolved, over the past 12 years, where I used to do tons of reconstruction. Now I'm doing cosmetic surgery. And it's just sort of been a really, really great career.
Well, I applaud you, even for almost transforming some things I think about plastic surgery during the short amount of time in this conversation. Thank you.
You're welcome.
Wow, it kind of just transforms how you're thinking about things. That's amazing. But thanks for all you're doing in the community. Thanks for treating people like family when they come to Stutman Plastic Surgery. I think that's really fantastic. And hopefully we'll have you on again sometime.
It's been great, Amber.
Nice
talking with you.
That's been today's episode of the Scottsdale Living podcast. See you next time.